Right now in Connecticut, there is a major shift, what they call a rebalancing, taking people from inpatient settings like hospitals and nursing homes and bringing them into the community, which is the lowest, most cost-effective way to care for people. And actually, if you interview individuals, 90% of people say that being cared for at home is their preference. The Connecticut Association for Home Care and Hospice was trying to figure out where they were going in the future. And we knew what was coming down the pike with the Affordable Care Act and what was coming down the pike in terms of legislation here in the state of Connecticut. And we knew that people didn't understand who we were. Actually, our members didn't even understand who they were. We couldn't even demonstrate and speak to our value because we didn't know what the right words were. We've kind of come from this mom and pop cottage industry attitude and way that we kind of dealt with the business aspects, and we needed to transform it into something that was much more sophisticated, coming through as the cost-effective solution. So the exercise that we did in terms of this rebranding helped us define who we were for ourselves. So we went through a year-long exercise. It was a full 360-degree review, including state association providers, along with national partners, along with state legislators, and we had to end up changing our name so that people would have a better understanding of the scope of services that we provided and what our agencies provide. But we also had to take a hard look at ourselves so that we could figure out the terminology that we need to use to be able to explain the value under three core areas, which is the Affordable Care Act deliverables. And then once we went through the process, we came out with a really nice package of messaging and a narrative that we could go to the state capitol with and talk to legislators, help them understand what our value proposition was, as well as talk to the governor and let him know that we're not just a cost-effective health solution, we're a cost-effective solution to the state's budget challenges as well, because healthcare is such a critical component of the state budget. People are getting to understand now through our new brand that we're not just individual agencies, we're healthcare at home, which incorporates so much of all the different services packaged in a way that that people now understand the value that we provide across the continuum. And the "This is healthcare at home" is perfect. I mean, it's just, we've had comments from a national basis that, this is really a perfect slogan for everything that we do, and they love it. We were looking at this more than just give us a new logo, give us some fresh colors, and, put a little bit of window dressing on it. This is really a strategic move for us to redefine who we are as an industry. This was critical for us to be able to take this point in time and figure out where we needed to be viable in this new healthcare delivery system and use a message that would really resonate with the state and with the federal government so that we could move forward in a very powerful fashion. And it's happened. We've been very delighted with the results. The messaging that we're using is not only helping our agencies educate themselves on where they need to be, it's been bringing the agencies along, but it's also positioning us well as an industry for the future.